Good evening, Dr. Srinivasan. Can you tell me something about your background? How, as an internal medicine specialist, you got into lab services and blood banking?
Well, I did my MD in internal medicine between 1978 and 80 in Madras Medical College with the hope of becoming a good clinician. Especially, I wanted to specialize in diabetes. But I ended up starting my career as a full-time physician at CSI Rainey Hospital in 1981, which I really enjoyed. It was a time when we didn't have ultrasound, we didn't have CT scans, but we had the courage and pleasure of doing so many biopsies and aspirations under just our knowledge of anatomy and surgical skills. While I was there as a physician, the one thing I found it was lacking was a good laboratory, a basic laboratory, which can support or prove or disprove the clinical diagnosis. So I took interest in setting up the laboratory for the hospital, and over 3 years it became one of the well-equipped hospitals in the city of Chennai. In 1984, I had to go on a sabbatical to Scotland, to the University Medical School Aberdeen, to pursue my interest in endocrinology and diabetes, and especially the pregnancy diabetes under the Starwalds, John Stowers and Sutherland. When I came back, the situations were such that I was forced to quit my job and look for what to do next. That was the time the decision to start a laboratory came up, basically because I've been on both sides of the fence. One, as a physician who has been asking for tests. Two, as a person who has set up and managed a laboratory in the hospital to provide the best that the patients and the clinicians needed. So it was this which pushed me to take a new turn and start a clinical laboratory in the name of Lister Laboratory on 6th June 1985 in Chennai.
Having established a very high standard in lab services, you went on to transfusion medicine, and at that time the guidelines must have been different compared to what it is now. Can you elaborate on what has been the standard of practice then and what is it now?
Okay, the reason behind getting into transfusion medicine was something a totally different, unexpected academic pursuit. It was my colleague Dr. Saranya Narayan, who is the microbiologist and director at Lister Laboratory, who came up with a startling revelation that over 60% of patients who tested positive for HIV or HBV or HCV have had a surgery and a transfusion in the past 1 year, clearly establishing a cause and effect. I'm talking about early 90s, and that the major surgery at that point of time was the craze to do an open heart surgery. Well, when she came up with the idea that we should be getting into setting up a blood bank as a not-for-profit venture, it took us almost 3 full years before it's being put into place. Finally, on the 1st January 1985, we took a decision that we'll form a trust and we'll set up a blood bank as a not-for-profit program and translate our experience and knowledge which we gained in running the laboratory in terms of testing the blood samples, the donor samples in the blood bank. It took us 9 months and 24 days, probably a full term, to start Jeevan on September 24th, 1995. And when we started, ironically, on the day which we inaugurated, there was a half-page article in the Hindu on 24th September, which they titled "The Bloody Business," which talked about the paid blood-giving system in those days, because the licenses were not too tight. The paid donor program is still prevalent, and just before few weeks before we decided to launch the blood bank was the time the Supreme Court came up with the judgment about banning the paid donor system in India. From 1995, after 2 decades in 2015, there have been a lot of changes that have happened in the transfusion medicine area. When at that point of time, even till about 6, 7, 8 years back, when they asking and giving a unit of blood is something like asking for 4 paracetamol tablets in a pharmacy or the over-the-counter prescription story. So the doctor asks something, the blood bank medical officer or technician will hand over those units after cross-match. But today, after the evolution of the transfusion medicine as a specialty, I think the transfusion medicine is getting a respect, and we have today specialists who are able to question the use, the appropriate use and adequacy of the use of blood and blood components. From whole blood we have moved on to blood components. From single unit, which is now slowly reducing, we have moved into questioning the need for transfusion at all. The way in which transfusion medicine might go over the period of next 10 years, 5 or 10 years, is that it will reach a stage of more into cellular therapy and cellular medicine. When I say that, today the clinical trials have started with artificial blood, which comes essentially from the laboratory, which comes from donated cord blood stem cells, that's the CD34 positive cells, or the embryonic stem cells which are being manipulated to give the red cells. The platelets, last year's Nobel Prize is for the IPS, where the scientist is able to synthesize platelets from the pluripotent stem cells, and this is probably will become a reality in 10-15 years. So this, from the over-the-counter story, we have come into evolved into a highly specialized domain, where there is certainly a large role for transfusion specialists today, who probably will turn into cellular specialists of tomorrow.
If a young doctor wants to specialize into transfusion medicine, you have given an idea about the scope of the field that you can get into. What will be the status in 10 years' time in India that you can predict?
The need for transfusion medicine specialists is only growing up. It's growing up, and also from the point of the if I can say, the return on investment, or in terms of the salaries that these people get, it's been very, very impressive, very, very impressive. The need for transfusion medicine specialists only is going to increase for 2 or 3 reasons. Number one, the blood banks will need transfusion medicine specialists. Today the licensing norms are changing. Earlier it used to be in MBBS with so many number of years of experience. Then it became an MD pathology or DCP. And today the guidelines are started insisting on having a transfusion medicine specialist for a blood bank. So there is going, and also the second thing is that the concept of moving away from the smaller nursing homes and small 4-bed, 5-bed care units into multi-speciality hospitals, could it be 20 beds or could be 30 beds or 200 beds? I think these are growing up in a large number, keeping in mind the changes which are happening in standard care of practice in medicine. The scope for a transfusion medicine specialist, an MD in transfusion medicine, is going to be pretty high. As I mentioned earlier, it's not going to stop just with transfusion medicine, because there is a strong thrust that is coming into so many bone marrow donor registries cropping up in India, public cord blood banks coming into the picture. The transplant medicine is going to move in, is going to scale up. Though the transplant medicine is under the domain of hematologists, it is pretty sure that the transfusion specialists will play a very significant complementary role, especially in peripheral blood stem cell harvesting and administration. So to sum up, I strongly believe there is a great scope for transfusion medicine specialists.
What are the good centers offering courses in transfusion medicine in India, and can you name some abroad as well?
Yeah, within India, I think some of the best centers are available in CMC Vellore. If you move further up, Postgraduate Institute in Chandigarh, the Postgraduate Institute in Lucknow, and we have the MD Transfusion Medicine happening in the MGR Medical University, the Ramachandra Medical University, and there are quite a good number of teaching institutions which are coming up in both in Delhi and other parts in the West. Well, in terms of going abroad for training, I think what is going to be done abroad in terms of a training in an MD transfusion medicine, possibly the whole thing can be learned in India itself and used in India itself, and the scaling up of the knowledge or improving the knowledge in terms of cellular medicine and transfusion medicine can happen today sitting at your home, listen to so many webinars that are available, as well as the conference material that are available on the internet. Attending good conferences of European Society of Blood Transfusion or National Health Services conferences, Indian International Society of Blood Transfusion, or the American Association of Blood Bank conferences give you enough information to improve your knowledge and the way in which you can deliver your services.
Tamil Nadu boasts of 200, a bit more than 200 blood banks. Is this a necessary number? What would be the best way to utilize blood and have a good blood banking system across the state?
Well, Tamil Nadu has over 200 blood banks. India has over 2,220 blood banks as we speak. And we have something like about 8 million units of blood which are collected, processed and transfused in India annually. If you look at countries which do almost 4 or 5 times what we are talking, or the 20 million units which is happening in US annually, they probably have something of 10% of the number of blood banks that we have. For example, UK has just 4 blood banks for the whole country, and US has something like about 21 blood banks if my memory is right. Now, one of the problems is that when you run any organization, whether it's for-profit or a not-for-profit, there is a breaking point even if you use public funds. For a blood bank to do things efficiently for the purpose for which it's established in terms of providing the safe blood and blood components, it should be handling nothing less than 5,000 blood donations in a year, on an average about 400 blood donations a month. If we do not have that sort of a volume, the blood bank is not sustainable, and if you have to sustain that, you need to cut corners. That is exactly what is happening in 80% of the blood banks which exist today. They are collecting less than 1,000 units a year and ending up using rapid tests, ending up using as whole blood. So I'm not a pretty happy person to sit and receive blood from any of these blood banks. Now, how do we change this? I don't think we need to, and I can say it's not a hearing.